Hello, everyone. Thank you so much for joining us today as we go through our USMLE question and answer series. Today, we're joined by the wonderful Dr. Chaudhry. How are you doing today?
I'm good. How are you, Megan?
I'm very good, very good. We're working from home today, and then, the weekend's just around the corner, so it's good.
Yes, looking forward to it.
Yeah. So let's head into our questions and stuff.
So Megan's already introduced me, but my name is Dr. Chaudhry. Along with my co-counselors, Dr. Hegburn and Dr. Kinchlow, we do these webinars every couple weeks. Usually you guys will see the question come up on Instagram and platforms, and then we take the time to go through the question with you guys so we can provide you some more background information and some tips and tricks on how to approach USMLE style questions. This week, I will be discussing some mood disorders, so really exciting stuff. Not too depressing, I hope. So the question that was already posted, I'm just going to go through it. So we have a 19-year-old woman who presents at clinic with complaints of fatigue, difficulty concentrating at work, and weight gain. She's had increased appetite, difficulty falling asleep, and does not want to participate in any social activities with her friends that she used to enjoy. She works at a phone service call center and has experienced these symptoms for about 4 weeks. She has not experienced these symptoms before and denies any includes asthma and eczema during her childhood. The patient tries to stay active, however, she hasn't exercised for the past month, and family history includes schizophrenia in her maternal uncle, myocardial infarction in her father at the age of 55, diabetes in her mother. On physical exam, reveals a healthy woman. Her temperature is 36.5 Celsius, 97.7 Fahrenheit. Blood pressure is 115/77, and respiratory rate is 14 breaths per minute. So what is the most probable diagnosis? Is it bipolar disorder, bipolar II disorder, persistent depressive disorder, premenstrual dysphoric disorder, or major depressive disorder? We'll give you guys a couple minutes to think about what your answers are. Usually on the step 1 exam and the other step exams as well, you get about 90 seconds per question. Now, when I'm approaching USMLE questions, I always like to start with the last diagnosis so that I'm able to frame myself, and when I'm reading through the vignette again, that I know which key pieces of information that I'm looking for. So in this case, we're looking for a diagnosis. And then going back through the vignette, we have a 19-year-old female. So chronic conditions, less likely, but still possible. She has fatigue, she's had difficulty concentrating at work, and weight gain. So looking at these symptoms, it could be depression, or it could be some other underlying cause, such as hypothyroidism, because that's also associated with weight gain. So trying to come up with a couple different differentials. She said increased appetite, difficulty falling asleep, and she doesn't want to participate in any social activities with friends that she used to enjoy. So this is more common in depressive disorders, especially not enjoying. She works at a phone service call center and has experienced these symptoms for the past 4 weeks. So this isn't just some, run-of-the-mill feeling sad. It's been going on for quite some time. So there is some underlying concerns here. She hasn't experienced these symptoms before, and she denies any suicidal ideation. For any patients that are experiencing depressive symptoms or manic symptoms, you always want to ask about suicidal ideation because you don't want them to injure themselves or to hurt anyone else either. Her past medical history includes asthma and eczema during her childhood. So this, her depressive symptoms could be related to medications. Some medications are known to cause. She's had this in her childhood, so currently she's probably not on any medications that would contribute to her symptoms. The patient tries to stay active, however, she hasn't exercised for the past month. Again, this points more towards depressive disorder because she used to enjoy exercising, but she no longer does. And family history includes schizophrenia in her maternal uncle. A lot of psychiatric disorders do have some genetic patterns. So if there's an individual in the family that does have a psychiatric illness, then it's more common for other family as well. Myocardial infarction in her father at age 55. That is not really contributory towards her current symptoms. And the diabetes in her mother, again, not really contributory towards her specific symptoms. On physical exam, she's normal. So there's no thyroiditis or, a hard thyroid or any other physical symptoms that may lead to a more organic cause rather than a psychiatric cause of her symptoms. Temperature, blood pressure, and respiratory rate are all normal. Now, going through the different answer options, bipolar 1 disorder, you have hypermanic and hypomanic symptoms. In her case, she just has depressive symptoms. There's no instances of mania. Bipolar 2 disorder, again, you do have hypomania and hypermania, but in this case, she only has depressive symptoms, no manic symptoms. Premenstrual dysphoric disorder, that would mean that it would be more associated with her menstrual cycle, but she's been experiencing these symptoms ongoing for 4 weeks. So it's less likely to be associated with her periods. And most of the symptoms that we are noticing in this patient point more towards major depressive disorder. So hopefully you guys were able to reach the same conclusion that I did, that this patient does have major depressive disorder. So major depressive disorder, you have symptoms of sad or depressed mood, sleep disturbances such as insomnia or even hypersomnia. It can vary from patient to patient. Anhedonia, where they lose interest in the activities that they used to enjoy. They may have some guilt or self-loathing. Often they'll have decreased energy, difficulty concentrating, or change in appetite, either increased or decreased, as well as psychomotor agitation or retardation, and even suicidal ideation, which is why it's really important to ask your patients that are experiencing these symptoms, do they have any of these ideations? In this patient, she had at least 5 of the 9 symptoms, one of which was anhedonia, loss of interest, and she was, in her case, the symptoms have been going on for 4 weeks, and these are all required criteria by the DSM-V for diagnosis. And again, there is a genetic component of this disease, but this vignette does not mention family history of major depressive disorder, although her uncle did have schizophrenia. So for diagnosis of major depressive disorder, it's mostly a clinically diagnosed based off of the criteria that are presented in the DSM-5. Electrolytes, thyroid stimulating hormone, and vitamin B12 and folate levels to rule out any physical disorders that can also cause depression. So the DSM-5 criteria, there's a lot of information to remember, so it's always nice to have a mnemonic to lay out the information in an organized manner. In this case, for major depressive disorder, the mnemonic is SIGI CAPS. The S is sleep changes, which can be increased during the day or decreased sleep at night. Loss of interest in activities that you used to enjoy. Guilt or a feeling of worthlessness, they devalue themselves. Energy or lack thereof, they're often fatigued, and this is most common presenting symptom. C is cognition/concentration. They usually have difficulty concentrating. Appetite usually is declined, but can be occasionally increased as well. The P is psychomotor, whether it's agitation, anxiety, or retardations, and they're feeling lethargic. And the S is suicide or preoccupation with death. So some differential diagnoses to keep in mind along with major depressive disorder are physical disorders that can cause depression, such as vitamin B12 or folate deficiency or hypothyroidism, demoralization or grief. This is in response to a significant loss, whether it's like, death of a family member, or, they were expecting a promotion that they didn't get, or, sitting for an exam and they didn't do as well as they wanted to. It's more of demoralization/grief. And the symptoms only last a few days. They're able to move on from whichever event led them to feeling a little bit demoralized. Early dementia in elderly patients can also present as psychomotor retardation and decreased concentration. So this is something you want to look out for in your elderly patients. In our case, in the vignette, it was a very young female, so we wouldn't expect her to have early onset dementia at such a young age. And dysthymia, which is low mood that occurs for at least 2 years, along with 2 other symptoms of depressive disorder. But in the case of this vignette, our patient, she had most of the criteria that did meet the diagnosis of major depressive disorder. So any sort of mood disorders are always along a spectrum. There's no one like definitive, like this is absolutely what they have. So you want to look at it across the various symptoms that they do present with. So with depressive disorder, they may have mild depression or maybe very severe where they have, they can't even get out of bed in the morning and they have no interest in doing anything at all. Or it could just be mild depression, like they're still able to function, but they're feeling a little bit lower than they usually do. Cyclothymia is another differential where they'll have mostly normal mood, but then they may sometimes feel a little bit more manic and sometimes they'll feel a little bit more down. And then your bipolar disorder, you have the whole range where they'll have episodes of being severely depressed, followed by episodes of severe mania, sometimes even with psychosis. So as you're approaching questions related to mood disorders in mind, as you're approaching like what kind of symptoms are they presenting with, and also the timing of symptoms. For major depressive, they have to have it for at least 2 weeks. With bipolar, also it'll be for several weeks that they're having these symptoms. It won't just be for a couple of days. For a couple of days, it's just grief. Right, now going through the other options, bipolar 1 disorder usually presents with at least 1 manic episode, and depression, where the depression usually precedes the first manic episode. And according to the DSM-V, mania presents with a sense of grandiosity, insomnia, pressured speech, flight of ideas, decreased concentration, and either hyperactivity with increased goal-directed or non-goal-directed actions. They're kind of all over the place. They may buy new power tools to start a project, but then after a week, they become disinterested and or they'll spend a lot of money, or they'll come up with new business ideas and they want to spend all their savings on these ideas where it's not the best approach, nor is it fiscally sensible. The manic episode will consist of at least 3 or more of these symptoms for at least 7 days, and it results in functional impairment. Functional impairment is very important towards diagnosing mood disorders. If they're not functionally impaired, then it's not a mood disorder. The patient in our vignette didn't exhibit any of these symptoms of mania, but she does have depression, which makes bipolar 1 unlikely. Bipolar 2, on the other hand, presents with at least 1 hypomanic episode and depression, where the depression usually precedes the first hypomania, presents with a sense of grandiosity, insomnia, pressured speech, your flight of ideas, decreased concentration, and again, hyperactivity with goal-directed or non-goal-directed actions. But the hypomanic episode will have 3 of the symptoms for at least 4 days, but there's no functional impairment. The patient, again, doesn't exhibit any of these symptoms, making a major depressive disorder more likely. And then your persistent depressive disorder presents with depressed mood that occurs for at least 2 years. In our case, it was only 4 weeks. And so the patient doesn't meet the criteria for this specific diagnoses. And she has 5 out of the 9 symptoms for major depressive disorder. And for answer option D, your dysphoria, mood lability, and anxiety during the premenstrual phase of the cycle, but usually dissipates with the onset of menses. This condition is comorbid with major depressive disorder, and antidepressants may be needed to help these patients. The information given determines that the patient's presentation and timeline criteria, they meet more of the criteria for major depressive disorder than any of the other given disorders. Okay. If you guys have any questions or comments, do please leave them below and we will get back to you as soon as possible. So feel free to reach out through that platform as well. We love hearing from you guys, so please do reach out.
Yes, thank you so much for running through that question. It was so detailed, and I don't know too much about this because I am not on the medical side, but learning about these things week after week, it's really informative, and I mean, I learned a lot, and I hope you guys are learning a lot too, and preparing for step 1, all the USMLE resources. This is a great tool to kind of, brush up on what they're going to ask you and the phrases, like things that they're looking for, coming from somebody who's taken it, passed it successfully, and all that good stuff. So thank you so much again for joining us today. We will see you next Thursday on social media for a new question. And then that following Thursday, we're going to be going live like we are today, going through the last week's question. So thank you, everybody. We hope you have a wonderful weekend and enjoy the rest of your day. Bye.